Assalamu alaikum. Good afternoon, everyone. My name is Lina Al-Arian. I'm the Executive Director of the Coalition for Civil Freedoms. Our mission is to defend civil liberties and freedoms, promote a fair criminal justice system, and advocate for political prisoners targeted in the war on terror. Joining me today is Sasada Abdulqader, the daughter of Holy Land Foundation political prisoner Mufid Abdulqader, who recently tested positive for COVID-19 at a federal prison in Texas while serving a horrific 20-year prison sentence for charitable work. Abdulqader had previously warned of the rapidly deteriorating situation at his prison just days ago on his birthday on July 1st, on which he turned 62 years old. His age, of course, putting him at higher risk of deadly complications due to COVID. Days before testing positive for COVID-19, Abdulqader described the horrid conditions at his prison that left him and the many other inmates vulnerable. For those of you who may be unfamiliar with the case of the Holy Land Foundation 5, they're 5 Palestinian American prisoners of conscience who ran the largest Muslim charity in the United States and were convicted in the post 9/11 hysteria on false charges of providing material support for terrorism. It took over a decade of investigation, harassment, and political prosecution over the course of 2 trials to convict these men, who were then given draconian sentences ranging from 15 to 65 years in prison and placed then in communication management units or CMUs, often dubbed, of course, Gitmo North due to the severity and discriminatory nature of their prison conditions. To learn more about this case, one of the worst miscarriages of justice in our time, I highly encourage you to purchase Miko Pelled's excellent book entitled Injustice, The Story of the Holy Land Foundation 5. Early in the pandemic, Mufid Abdulqader was denied release by the warden at his facility, but his attorneys are now filing an emergency motion for compassionate release by a judge in Texas, in Dallas. I'm grateful to Sasada Abdulqader, who's going to give us a quick update on her father's situation. Thank you, Sasada, for joining us. I'm sure this is a very difficult time for you and your family. I'm so sorry for what happened to your dad. Could you tell us what his condition is right now, please?
Yeah, so thank you so much, Felina, for having me. When I spoke to him as of yesterday, he was starting to get some of the symptoms that someone with COVID starts to show. So he was telling me he had a runny nose, he had chills, he had diarrhea, he had he had most of the symptoms. As of right now, he told me there's really nothing that the prison is doing. They have just simply lumped everyone who's sick all together in one area. They're not isolating individually the sick inmates. So he's in a section of about 300 sick inmates right now. The prison that he's at currently, as of yesterday, had 488 positive inmates for COVID. And the severity of the situation is totally man-made. Actually, he's calling me right now.
Oh, wow.
Yeah,
okay.
let me see.
Sure. Yeah. Please send me عليه.
Hey, call. You will not be charged for this call. This call is from
Abdul,
an inmate at a federal prison. This call is being recorded and is subject to monitoring. Hang up to decline the call or to accept. Dial 5 now. If you wish to block.
السلام عليكم بابا.
السلام، كيفك بابا؟
أهلا يابا، كيف حالك؟
الحمد لله. Okay. How you doing بابا؟
الحمد لله. كيف أعراضك اليوم؟
ما في شيء بابا. ما عندي شيء. أنا sometimes عندي congestion nose, runny nose, and chills. But other than that, يعني I'm okay.
You're okay for now? Yaba, we're on a webinar right now. I'm doing a webinar right now for the Coalition for Civil Freedoms. إذا حابب تحكي كلمة أو إشي.
مش فاهم.
هلا we're doing a webinar يابا على قضيتك to raise awareness. أنت حابب تحكي كلمة؟ It's live on Facebook. حابب تحكي إشي؟
السلام عليكم عمو. أنا لينا العريان بحكي مع بنتك سارة.
هلا
كيف حالك؟
لينا.
أهلا ألف سلامة عليك الله يشفيك يا رب.
الله يسلمك يبارك فيك. هذه شدة ما بتستمر. هذه نعم رب العالمين. احنا صابرين ان شاء الله تأمين رب العالمين. الحمد لله على كل حال. ما عندي شيء حتى احكي لانه مش عارف بقدر احكي الان. ناس سبونا مشاكل في السجن.
بسبب مشاكل يا عن جد عن جد.
فلازم احكي مع ساره مباشره يعني. ما غير الخط.
انت احكي لي طيب. طيب احكي لي بابا.
Sara, by the way, if you want us to break real quick and you can finish the call, we can resume because you're right. I apologize. Okay, so Sada just muted herself. I just remembered actually that her father, God forbid, could get in trouble for speaking to somebody who isn't his immediate family. So she's just going to talk to him real quick and we'll resume. In the meantime, we're going to throw up a graphic with some actions that you can do to call the prison to ensure that he's receiving adequate and proper medical care. Here, we have it right now. So in my own experience, as a daughter of a former prisoner, anytime something happened with my dad, it was really impactful to have a lot of grassroots support of people calling kind of to put the prison on notice, making sure that they're taking care of the prisoners, that they're treating them humanely and, not allowing them to suffer while they're in their care. So please continue to call the prison, flood their phone lines, and let them know that you care about, Mufid Abdulqader and ensuring that he's okay as he battles the coronavirus in their custody. And of course, Mufid Abdulqader, he actually doesn't even have that much on his sentence left. He's due to be released maybe in the next couple of years, a year or two. And so his attorneys are filing, in accordance with the First Step Act, a compassionate release motion to the judge requesting his early release based on these extenuating circumstances. So please call FCI Segoville, where his daughter Sada said there are over 400 active cases of the coronavirus. They're not adequately protecting the inmates. They're not preventing any further spread of the virus. They're just housing all, whatever 400 some odd inmates together, just kind of this massive area for people who are sick there. That's about it for now that I can say until Sada's back. I'm gonna mute myself for a bit and we'll start up hopefully in a couple of minutes. For those of you just tuning in and are confused, Sada had a call from her father from prison. And of course, these calls are extremely precious to family members once they get them. You don't know when your loved one is going to call again. I hope I didn't get him in trouble by saying hello to him. And hopefully he can continue to update his family on his well-being. So Sada had to mute herself briefly to take the call with her father. And I want to just give a quick shout out to our friends at PYM, the Palestinian Youth Movement, who created this neat graphic for us to help spread the word on social media, the call to action to demand that Mufid Abdulqader is receiving proper care at FCI Segoville, the prison in Texas where he's being held. For those of you tuning in, this is Lina Larian, Executive Director of the Coalition for Civil Freedoms. We're waiting for Sara Abdulqader to get back with us. She's on the phone now with her father, who called from prison. And of course, it's against the rules when you're calling from prison to speak to anyone else who's not your family. So she had to mute herself and take his call. And hopefully she'll be she'll be back with us shortly to give us a full update on her father's condition. A little bit of background for those of you who are unfamiliar with the specific charges against her father that were used to prosecute him in a politically motivated case and convict him on entirely political charges. Mufid Abdulqader was actually a singer, a very talented, he's a civil engineer by training, and a talented singer who used to perform with his band at fundraisers for Holy Land Foundation's charitable work. And he's literally serving a draconian 20-year sentence for singing at events. This is America, and unfortunately, you know. Okay, I think I almost restarted my computer by accident. So these are some of the hazards on the job, right? Work related. For those of you who are still with us on Facebook, if you want to make any sort of comments or words of support, you can convey to Sasada. We can send those over to her. Hopefully next time she speaks to her dad, maybe she could read some of your nice comments to him. If you have any questions for me, I'm happy to do my best to answer them, just as we wait for them to finish their phone call. For those of you just joining us, Sasada Abdulqader received a call from her father from FCI Seagoville, and she's just finishing up the phone call with him, and then hopefully will rejoin us to give us the full update. Funny enough, my next question to her was, when was the last time you spoke to your father? So now we know, and you know, we'll get a very recent update from him through her. For those of you just joining us, we're waiting for Sasada Abdulqader to finish her conversation with her dad. I definitely can relate and sympathize with how precious these conversations are with our incarcerated loved ones, especially given that her father is sick right now. It's tough enough to have a loved one in prison. It's even harder knowing that they're sick and, this awful, deadly disease that people are still figuring out, who it really afflicts and who ends up being kind of okay from it. But you just don't know until it's over. So we definitely want to try to advocate for him, make sure he's getting proper care there, to the best of our ability on the outside to do so, to ensure that, of course, at least putting the prison on notice, letting them know that he has a huge base of support on the outside of people who are following his condition until hopefully he can recover or until the judge can grant him early release due to these extenuating circumstances. I believe that number on the screen, the 972-287-4097, that should go to directly to the health unit at the facility. So let them know that you're calling in regards to Mufid Abdulqader and you're aware that he contracted and tested positive for COVID-19 and you want to make sure that he's getting proper medical care there. Okay, so Sada is going to rejoin us now. She got logged out of Zoom, so I'm going to tell her to quickly log back in, and she will give us the quick update from her dad. Okay, give me 1 second. I'm just going to give her quickly the Zoom ID, and we will get her back on ASAP to give us a full update on what's happening with her dad. Give me 1 second. Okay. And I want to thank you all for waiting so patiently with us and bearing with this delay. Okay, giving her just quickly the webinar ID. Oh, there she is. All right, you're faster than I am, Sada. I'm sitting here typing it one by one, and I'm glad you're able to get back on. I can't hear you. Are you, can you say something? Can you hear us, Sada? Okay, hang on. All right, I think I hear you. Can you, are you there?
Can you hear me?
Yeah, now I can. Okay, great.
Sorry, I don't know what the log was.
Okay, cool. How's your dad?
So he's okay. So he was actually just giving me an update. He usually calls in the morning. I was actually worried because I guess what worries me the most about him being there and being sick is like there's nobody to advocate for them. They have all the sick people in one area, and he was just telling me like there's really no medical like access at all. The only thing that they're providing is like Advil if you have a fever, and that's if you get it on time. He said the inmates usually have to go and like fight for it and ask for it like multiple times until they actually get the medication. So I mean the situation is not, I mean it's not really good. They're still having like multiple people in a room, and I think with the way the disease is going and nobody knows very much about it, kind of raises the question, well, should they be putting everybody who's sick all together, because what if there are people who have more mild symptoms and people who have more severe symptoms? Can they affect each other? Can they make the other person more sick? So this is just in my opinion, and I'm sure in the opinion of any doctor or anybody who's, I mean, I'm not a doctor, but I'm sure anybody who has background in what the CDC has been giving out guidelines is, this is just not how you handle things. The minute they found out somebody was positive, I think it was like 10 days ago, from the inmates, they should have, if they were following CDC guidelines, tested everybody, because they're all in the same area. They all use the same things. There's 5 inmates to a room that's 8 by 10. And they, use the same toilets, same showers, same kitchen, same everything. They should have tested everyone to be able to at least to kind of like separate the sick and the healthy, but they didn't do that. The only thing they were doing is checking their temperatures every morning. And I mean, based on what people have been saying about the pandemic, is not everybody shows the same symptoms at the same time. So you really don't know when the first person got sick or when they started to become contagious. So they're literally, we're just letting people who are sick infect other people until they finally showed a temperature.
Right.
And that's why they have so many, because the jail he's in actually has out of all of the United States, has the most inmates who tested positive, with the exception of one that has slightly more, North Carolina. So it was definitely, I mean, it wasn't something that I think they took seriously. And I think because of that, they're going to play with a lot of people's lives, because there's a lot of old people, like my dad, he's over the age of 60. That makes him a high risk. He has shortness of breath. There's a lot of other inmates who also have, health issues, and to not take things seriously or follow like CDC guidelines in this regards is just absolutely, unacceptable. These are people who have, loved ones. And I mean, it doesn't really, I mean, obviously my dad is innocent, but even for other people, I mean, these are human beings. Are they not, do not care about them, their health, their well-being? I think that's the biggest issue right now.
Described it, I read in an email, it's like being in a building with a fire and someone saying the fire hasn't reached your room yet,
Yeah.
And
that's literally what it was, because every morning I'd be like, okay, well, are they not going to test you? Are they not going to test you? Or they're not going to see, because my dad told me his cellmate, one of his cellmates who tested positive a week ago, was coughing all night in his in the cell. And like I said, it's 8 by 10. There's 5 people in there. Like, there's no way they, like, you wouldn't get exposed. They didn't give out masks. I mean, how much does a mask cost? You could have passed that out to all the inmates from the very beginning, once you knew that, there was a sick inmate. They didn't do that. They didn't do any kind of social distancing. They didn't ask the inmates to move, separate, nothing. So to me, it's like, if you know this is the situation, and you know the potential of this disease, and you know how deadly it is to some people, why are you not, taking precautions?
right.
Why are you not, because obviously we're not there as families. We could not advocate in person. This is their job, as human
Visitation has been closed for how long now? Has it, like, you haven't?
It's been closed since the beginning of March. So in Dallas, we had the first community transmission we had was like March, the middle of March. The minute we had community transmission in Dallas, the first case, like it was like one person got it, they closed down visitations. So there's no way that they got this disease from anybody but the guards, because they're the only ones coming in and coming out of the prison. Other than that, there's nobody else who's allowed in. So I haven't seen my dad since like the end of February.
Right. Gosh, I'm so sorry. The New York Times, like a couple of weeks ago, referred to prisons as being among the largest known clusters of the virus, even worse than nursing homes, and the inmates there are completely vulnerable, are just like sitting ducks,
Yeah.
You mentioned being infected by the guards and not being protected in any way.
Yeah, and not provided any kind of medical care. Like, let's say if you do have shortness of breath, are they offering like breathing treatments or, something to alleviate the symptoms? And they're just not doing anything. And my dad was telling me on the phone that it's kind of like, unless you're dead on the floor, like you're about to die, they're not going to give you any kind of like medical help. And the problem is, once they start doing that, it's a little too late, because in Texas, we've already had situations of inmates dying, not in the Seagoville prison because their COVID situation just got out of hand, but the one in Fort Worth, they've already had multiple, deaths due to this because they just were not getting help fast enough. There was a pregnant woman, she died.
In Carswell, yes, yeah, Native background as well.
Mm-hmm.
And just to quickly give a little case background for people.
Mm-hmm.
How old were you again? You talked about it in the last webinar when your dad was first arrested. And while you were on the phone with him, I was telling people just a little bit about the absurd nature of the specific charges against him and the fact that he was prosecuted for singing. I mean, your father has a civil engineering background, but also blessed with a beautiful voice, and he would perform with his band at charitable functions, fundraising events, and his singing was literally used to prosecute him. So if you could talk a little bit about that aspect of the case.
Yeah. So
starting with how old you were.
Well, I want to say I was 2 years old when they started like tapping our phones.
Right.
And so, it's kind of like they were illegally doing all of that for years, even before, the trial started. I was 11 when they arrested him. Obviously, like I said, it was a total surprise because we didn't especially with my dad being a volunteer, one of many volunteers, it didn't make any sense of how he would even be connected to the case. They said because he was their top fundraiser, even though on their own list of how much money that the various fundraisers for the Holy Land Foundation raised, he was not number one. So then the question was asked, okay, then why him? Why would you prosecute him when there's multiple other people who are also fundraisers? Just the charges of money laundering and conspiracy to money launder, it doesn't make any sense for someone who didn't even work there. He never signed a check, never had access to bank accounts, never did anything other than what you said is sing. And essentially the whole trial was them showing old videos of like him in the 80s, singing songs that he did not write, like they were trying to show that, this is his, these are his songs and these are his opinions. Lots of these songs were old traditional songs that somebody else wrote like long time ago, decades ago, and they're just traditional songs. And even the way that things were translated, it was all just extremely in my opinion, and I'm sure like anybody who has any understanding of law, it's, do you have a right to freedom of speech or not? Because if somebody is singing, I don't know how that can be used as evidence for conspiracy to money launder.
Right.
It's literally, he's singing traditional songs that people still sing now, that are all over on YouTube from, I'm going to say, hundreds of different people. Nobody owns those songs.
I mean, everything about your, father's and the HLF case just reeked, everything about it. I mean, really, it's just disgusting. The so-called expert witnesses. I smell Hamas. The disguised witnesses. I mean, really, like, if you aren't familiar with this case, and even if you are, there are just certain things you might even forget details, and you remember them. After a while, and you're just shocked at how awful and absurd it is.
Well, they kind of even implied that to help the Palestinian people humanitarily was a crime. And so it's like, so
right.
Does the United States not help? I mean, the United States sends usually millions of dollars to the Palestinian Authority. So then what, what I'm saying? Like, what difference is that?
I mean, literally the Zakat committees that, they mentioned at your father's trial, and his co-defendants were, the other political prisoners, I should say, the same Zakat committees that USAID was using to send international.
Yeah, and they still continue to do so years after our trial. So, I mean, it doesn't make any sense, and they knew that, and that's why there was such a difference between the first and the second trial. The first trial, my dad was actually acquitted of all 32 charges. because I mean, obviously the truth was there, and that he was acquitted with everything being against us in the trial. There was evidence we were not allowed to even have access to. They would classify it. So my dad's own phone call, he would only see like 2 or 3 lines. The government would have access to that evidence. We would not, which is again against the law. I mean, a defendant has a right to see the evidence being used against them. That was not done. In addition to the secret witness, I mean, if the president of the United States was going to testify as an expert witness, we would have to know their identity. There were 2, there was one, I think, from the Israeli Mossad and then one from the Israeli army. We were not allowed to have access to their identities. That the court on those days was close to the public. The only people allowed in were immediate family. So myself, my mom, my sisters, the other family members, like immediate family. And I mean, if you have to hide something, it shows you have, you know, the truth is not with you. And the people even testifying that they had brought, he had said he had never even stepped foot into a zakat committee. So how can you testify about something you never even saw, you know? I mean, it was just, the first time he was acquitted on all 32 charges, the government legally is supposed to read the decision from the jury immediately once it's given out. And the government, the judge was out. So the government asked that it be read by our judge, even though another judge offered to read the decision. And then when we came back on that Monday, one of the government asked the judge to poll the jurors, which is, it usually doesn't happen unless the jurors say we have an issue, but they had requested it. And one lady said, oh, I don't agree with this. And the head juror said, I don't know where this is coming from. You signed the papers, you agreed that he was innocent. So what is changing now? So all of that is just very, very fishy. And then the next trial, the jury was vastly different. You know, the first trial, there was a lot more mix of diversity. There's a lot of different people from different backgrounds. And then come second trial, it's predominantly white jury, very low level of education. And so it just, everything was stacked against us. So it kind of makes you question our justice system. So where is the justice? Why would all the laws and all the protections and all the rights that's offered to everybody else, why would that be denied to us, you know?
I don't want to keep you too long. I see your beautiful baby. And since we last sat down with you, obviously you gave birth to your son, Ali. I just wanted you to, you know, talk a little bit about what it's been like for you to have kids now of your own, and for you and your family to not have their grandfather in their lives.
Yeah, I mean, it's really hard because, I mean, I gave birth to my son a month ago and my dad hasn't been able to see him. Obviously, if he wasn't in jail, he would have. It's just, you kind of even question, like, when would he be able to? Because, I mean, with the pandemic, there's no visitations and the pandemic's not going to go away anytime soon. So I'm like, what is he going to be, like 2 years old by the time his grandfather gets to see him, you know, in person, or at least meet him, you know? So, I mean, we're trying our best, like, you know, to send a photo and stuff like that, but it's just, it's not the same. You know, these kind of moments you just don't get back. And to be deprived of, you know, these special moments due to injustice, that's what just makes my blood boil, you know? Because it's not, if someone had done something wrong and these were the consequences for it, then someone would have to accept that, you know? But to be unjustly attacked and literally, I'm gonna say witch hunted, the Muslim community here, it's just, it's unacceptable.
Right. And just, can you finally let the public know what they can do to continue to support you and your family and your father during this time?
So definitely, like, the first thing would be always, like, to raise awareness, keep sharing. Social media is a very powerful tool, you know, to get people aware of what's going on and what's happening. And another step that they could take is to, you know, call the prison and just let them know that, you know, Mufid and all the other prisoners, Amu Shukri and Amu Hassan, all of them, that we care about them, and you better be taking care of them, kind of just letting them know we expect them to have access to medical, supplies if needed, and, have a doctor take care of them if needed, especially during this time. And then there's also something on the BOP's website where you could voice a concern about an inmate. They could also do that as well. And I mean, obviously, the biggest step is, prayer. So we believe God can make miracles, and we're hoping that, inshallah, we get our justice soon.
Inshallah. Is there any final remarks you want to make to the public while we have you?
I mean, just thank you for your support, and please continue, to support us until justice is served. I mean, this has been a long time coming since the Holy Land Foundation was shot back in 2002. So just continue to support us and keep us in your prayers, and inshallah we'll all get through this. God is greater than anybody or anything, and his justice will ultimately, inshallah, be served.
Thank you so much for your time.
Thank you so much for having me.
Time out of your busy schedule. Before we close, I just want to make an announcement for a webinar tomorrow. Actually, CCF did manage to win a victory for a prisoner who was serving a 23-year sentence, a young man who was a victim of FBI entrapment. And, the sort of grooming by an older agent who got him, thank you, yeah, here's the flyer for it, who got him to go along with this manufactured plot. The judge agreed to grant him compassionate release based on a genetic disorder that he has that would cause COVID, to make him suffer extreme complications to it, and made him especially vulnerable. So please join us tomorrow. Victories like, as you can see from what Sara was describing, the situation in our prisons is extremely bleak. So this is quite a big victory. It's significant, especially what the judge said about him, which is that it was very clear that he posed no threat to the public, and that this was a plot that was, kind of led by undercover law enforcement agents. So please join us tomorrow. And I don't usually do this, but please continue to support, obviously, the HLF families, and make a donation to CCF to help us continue to file motions on behalf of other prisoners. We have so many left on our list. Please continue to fund the Coronavirus Prisoner Release Project so that our attorneys can continue to provide, legal support to inmates completely free of charge. So if you can, if you have a buck to spare, if you can chip in, please do so. So thank you again to Mufid Abdulqader, and we'll continue to pray for her father and make calls on his behalf to the prison. As I stated earlier, I can't overemphasize the importance of doing this. Prisons and their staff do take notice. So definitely continue your calls. And I think we're going to throw up the numbers for all the other HLF political prisoners where they're kept, just so their facilities as well can be put on notice. So thank you all so much for joining us on this quick live, and we will see you tomorrow, hopefully.
Thank you so much.
Thank you so much, Sara. Take care.